So good afternoon, everyone, and thanks so much for dialing in to our webinar today. Obviously, October is officially Safe Work Month across the nation. We understand safety is important across every day and every hour, but we obviously have the opportunity to focus in on safety and promote safety across workplaces like we are today. If you didn't already notice, Recovery Partners are participating in that month. Today is one of 4 webinars that we are hosting. Last week we had Risk Management Fundamentals. This week we have Psychosocial. Next week's will be on manual handling. And yeah, hopefully if you haven't joined last week's, this week's, you can join us moving forward. So yeah, just a brief introduction. My name's Chi. I'm the General Manager here at Recovery Partners. And again, delighted for you to join us. Today, we're talking about psychosocial risks and hazards. Obviously a huge topic of late last year, the formal regulations coming into place for not just New South Wales, but across the nation. So yeah, it's been a really positive start to where things are going. Obviously, lots of room for industries and workplaces to continue to get better, but so far so good as we see. So enough from me. I'm going to introduce you to our subject matter expert, which is today's guest host. So I'm fortunate enough to work alongside John, who is one of our subject matter experts in psychosocial risks. John has a dual qualification in both safety and human resources. He has a focused interest on training, and I'm sure you'll be able to get a lot out of today's presentation. So a little bit of background on John in terms of where he's worked across, displayed on the screen there. Thanks, John. All right, learning outcomes. We want you to understand, obviously, the importance of psychosocial risks. Again, there has been a lot over the past 12 months of webinars and information that has been distributed across the industry. We wanted to put a bit of a spiel on it today and really focus on some of the non-work related factors or worker factors that can potentially be brought into the workplace. Again, psychosocial risks, we're not dealing with robots or machines when it comes to this, although they might be part of the equation. So there is lots of different elements and things to think about when managing risks. So that's why we thought we'd have a bit of a spin to it, a bit of a point of difference, and talk about what are some of the non-work related things that come into the workplace. How do we really manage that and navigate things through that process on that. Some learning outcomes today. Again, work-life balance. We all hear that term thrown around so much. John will talk us through what exactly that will mean. The effects of healthy work-life balance. I know I'm certainly personally keen on achieving this and lucky enough to work for Recovery Partners who enable that. We want to talk about the effects of poor work-life balance. I've certainly been a part of that in the past, so I can speak for myself on what sort of impacts that can, and I'm sure most of us can relate to that at one point in time in our lives. We'll have a bit of a quiz. What is a good webinar without a quiz? Yeah, so there will be a lucky door prize for the best answer or answers, and yeah, be sure to get involved in that. We'll talk about some quick tips and some practical advice on how we can help navigate you through this, but apply this in your workplace moving forward. There will be some Q&A time for the end. So please, if there are any questions, feel free to throw them up on the chat as we go along. But we will bring that towards the later part of the session today and hopefully have some answers for you. If not, we will get you the answers separate to this. Enough from me. I'm going to pass you over to John himself. Over to you, John.
Thank you, Chi. So thank you for joining us today. So basically, the topic is psychosocial hazards and work-life balance. So what does work-life balance mean? Well, it doesn't mean allocating equal time to your work or activities. Work-life balance is the ability to manage our time properly by allocating our work time appropriately whilst continuing to maintain fulfillment in our personal and professional lives. So having that balance both in the workplace and in our personal lives and our home life. So just to look at where mental health is within the latest stats that have come out, it is at in the period 2022-2023, there was 14,600 claims made, and that's 10.5% of the overall national claims within serious claims area. What this looks at is in the next slide. The claims account for an increase over the last 10 years of 7,200 claims. So it's actually on the increase. And basically, they predicted this during COVID, saying that after COVID finished, we're going to see an increase in mental health claims coming through. So, what it has happened is that the average time lost for mental health illnesses and conditions is 37 weeks. So that's 5 times the average across the basic claims. And this is actually blown out over the last couple of years as well. So the average compensation paid for this type of claim is $65,400 compared to other claims which are around the $7,000 or $8,000 mark. So mental health conditions are one of the costliest forms of workplace injury. They lead to significantly more time off and higher compensation paid when compared to physical injuries and diseases. So being balanced can have positive effects on ourselves. So it reduces stress, prevents burnout in our work life and home life, improves our mental health and our physical health at the same time. So what does it mean by being unbalanced? We become unbalanced in our work and home life when too many of our work and household or family tasks or responsibilities are left disorganised or uncompleted. So the effects of poor work-life balance on mental health in most cases will indirectly impact a worker's productivity through unhealthy stress levels that are from one-off instances. They can be a one-off incident that has a big effect, or it can be a cumulative effect over an extended period of time. So it can lead to increased risk of anxiety and depression, mood swings, substance abuse, workplace injuries, and interpersonal conflict between co-workers. So the effects of poor work-life balance also covers the mental health impact when workers have insufficient time off work and work in very stressful areas or roles or sectors like emergency services, counsellors, insurance, where they accumulate so much annual leave, they're not having any downtime in their lives. So one solution to control poor work-life balance effects on productivity could be a worker that is well rested and healthy can be more able to handle the burden and capacity of the work than a person who is exhausted and tired. So a person suffering from fatigue will be less effective than someone who is well rested and ready for the day. So when a worker is showing symptoms of burnout and fatigue and asked to perform their daily activities, they're effectively trying to perform 2 jobs at the same time and not achieving either one very well. Those 2 jobs are work and home. So the quality of their work suffers on both sides, and they are incapable of completing their tasks to the best of their abilities due to this effect. So what are some common factors to look at? So increased responsibilities at work from worker reward for high performance they're given increased work obligations. They may have been seen as being potential team leaders, so they're given more responsibilities. So the other thing that's happening at the moment is organisations not refilling vacant positions, and the tasks being farmed out to remaining team workers, and they're expected to maintain not only their current tasks and responsibilities, but take on these other tasks and responsibilities as well from a job that may not be related to their area. So normal slow progression and increase of additional tasks and responsibilities added to worker job demands over time. So what that means is that a person will accumulate new tasks that are added to their role as they progress their working life with an organisation. They may have started off just being admin, but over time they've been given added responsibilities, but they're still an admin person. So, and then there's the longer working hours. Okay, what are some common factors in our home life responsibilities? Well, look, caring for spouse and our children, especially any newborns, caring for elderly parents, accessible daycare for children, before and after school care, children's after school activities, and then children's weekend sporting commitments. And as we've found out this year, a lot of those sporting commitments have extended over the course of the year due to bad weather within New South Wales. So a lot of games were postponed, and then other games were being added, and some of these games are being added in midweek. So you're not only having to worry about weekend sports, it could be that now, due to weather conditions, you're having to attend these sporting activities after school and after work. And then the cost of living has increased. So what can be done to improve work-life balance? Well, we can prioritise mental health of workers. We can complete a job satisfaction worker survey on what aspects of a worker's job, role or their task they feel may be of harm to their mental health, e.g. work design, job demands, hours and management style. And setting these boundaries between work and personal life with the new disconnect legislation coming in, that has increased that as well. Ensuring workers take annual leave and personal mental health days. Reviewing of commute times to work. Are they in traffic? I know when I leave for certain clients, I have to add, in some cases, an extra half an hour to an hour on my leaving time to actually make it to a client's premises on time, especially if you live in the western suburbs and you're travelling on some of the main motorways. They are usually at a standstill. So it's looking at that, and also looking at commuter travel with trains. Within New South Wales, as if you're not aware, one train line on the Bankstown train line to Sydenham will be closed down for a year. So therefore, people are having to catch buses between certain stops and Sydenham, which is adding extra time to their commute every day, both ways. Okay, so just a quick work-life balance quiz. So what I want you to do, this is yes and no. So I'll go through them and you just mark yes or no against these answers, against these questions. And it's just a way of looking at if there is any issues. So the first question, I feel like I have little or no control over my work life. Okay. Again, I feel like I have little or no control over my work life. So answer yes or no. Question 2. I often feel guilty because I can't be available for everything I want to do. Again, I feel guilty because I can't be available for everything I want to do. That can be within your personal life or in your work life. So 3, I usually don't have any time to spend with my loved ones at the end of the day. Again, I usually don't have any time to spend with my loved ones at the end of the day. 4, I never use all my entitled annual leave days. Again, I never use all my entitled annual leave days. 5, usually I'll work through my lunch break. Number 5, usually I'll work through my lunch break. 6, I frequently think about work when I'm not working. Again, I frequently think about work when I'm not working. 7, I don't have any hobbies or interests outside of work that I enjoy. Okay, again, I don't have any hobbies or interests outside of work that I enjoy. 8, do you often find yourself working beyond your normal working hours? Again, do you often find yourself working beyond your normal working hours? 9, do you feel pressure to remain connected to work while on holidays? Again, do you feel pressure to remain connected to work while on holidays? And 10, you're not aware of all the wellness resources being provided by your employer. Again, you're not aware of all the wellness resources being provided by your employer. Okay, so that's just a quick quiz. It's not meant to show anything. I'm not a professional psychologist in this area. This is just as a reflection activity. So let's just look at it. So work-life balance quiz. Whether you answered yes or no to the questions may not mean you have an issue with work-life balance. So some people may be able to cope better with similar workloads and outside work communities better than others. This is just a way of seeing if you do believe you have any issues. So the questions to ask yourself are, how do I feel about my life currently? How does my work impact my moods at work or at home? How is my time, energy, and resources currently distributed between work and home? So these are the questions you can reflect on in what you've answered within the quiz. Okay, the process of controls and actions. Which psychosocial hazards should be addressed first? So if we're looking at work-life balances, we can address issues at the same time, or the workplace can focus on one or a few of them at the same time, or address some of them later. There's a lot of room for creativity when implementing control measures. Always try to think out of the box wherever possible. And sometimes actions do address one psychological hazard, can also help improve other psychological factors. So one action can actually address 2 or 3 other psychological factors within the workplace. So develop and implement a plan, okay? Your work context and work content factors will differ from that of other similar organisations and work groups. So any plan to prevent and manage stress and psychological injury must be based on specific risk identification and assessment process for your organisation. So one size does not fit all. So how should we attack an action plan? Well, look, what we're looking at is a primary intervention, a secondary intervention, and tertiary interventions. So primary is what we're going to do first. So addressing the workplace factors that are risk of psychological injury, such as poor work team climate, by developing solutions to treat the identified risks. So secondary intervention, minimise the impact of stress on employees by responding to warning signs and intervening early to ensure that individuals who are not capable receive assistance and support. And then tertiary, so this after everything the person is already had an injury, is implementing safe and effective rehabilitation and return to work strategies. So again, your action plan should be looking at these three areas: primary intervention, secondary intervention, and tertiary interventions as a means of addressing everything. So a really important part of this is communication. So we want to communicate to everyone about the control measures that we're putting in place. It helps them in understanding the purpose of the initiative or change and how these will be implemented, monitored and evaluated. So basically it's showing the commitment from top management right down through the organisation. Workers more likely to participate. Workers have a better understanding of the processes and outcomes. And also worker updates provided during regular events provide an opportunity to ask questions, receive feedback, and change the processes. So some key tips when we're looking at our action plans and controls. Make it manageable. Keep it simple. Integrate with business activities. Achieve buy-in from workers. Ensure effective reporting, and ensure action and implementation is confirmed. That's right, Julie. That's why we need consultation, is to involve everyone in the process, and that's why we have the communication occurring. If you're not consulting, then are we hitting the mark? So just remember, as every person's situation is unique and different, is it possible for an organisation to propose a one-size-fits-all solution to address every worker's work-life balance psychosocial hazard? And any questions?
Right. Thanks so much, John. Really, really informative. We will take it to the floor to ask any questions. So, feel free to throw anything that you haven't already asked or something that you're hanging to get an answer on. No silly question is a silly one. Feel free to put up anything there. Whilst there might be some questions coming through, I might just throw up a couple of scenarios. I've got a couple of young kids, and I certainly have really appreciated what sleep is when I do get it. John, if you know that if you're my team leader, I'm coming into work, either I'm preparing for the birth of a child or maybe my first one or second or third, what are the things that you could do as a team leader to help with the management? Because I know, again, I'm mindful of the effects of fatigue and sleep. I'm coming into the workplace and I'm not looking that like I'm the sharpest. What are some of the things that you could probably put out there to say what some of the team leaders or direct leaders should do in workers in that sort of scenario?
Well, look, we can look at flexibility of start times and finishing times. Okay. You know, if you're having a bad night's sleep the night before, it might be better to come in later in the day. In looking at that, also sometimes working from home, especially if you're commuting, say for an hour in traffic or more, that it is an effective way of dealing with that for short periods of time. Or I'd say it would be an ongoing thing. It'd be one of those things that you would consult and reflect on as it progresses.
Yeah.
especially
All right, so now,
especially in the first few months of the baby being born.
No, that's really good. I mean, if I don't have the flexibility, so for reason or example would be I work in a processing plant in a manufacturing line. There are very set and limited shifts available. What are some of the things if you can't really accommodate the start and finish times or the ability to work from home? Because I know there are lots of industries that don't have that flexibility. What are some of the things that you could put in place or suggest to a leader that again is observing someone that is quite fatigued or a little bit out of whack?
Look, I guess it depends on each situation. Looking at it, depends on what the workload is. It could be that during downtime, you could have a short nap if you're feeling fatigued, or take yourself, especially if you're on a production line, then the team leader should be looking at your behaviours and observing if you are being fatigued, then you should be taking you off the line and say, look, take a little bit of 10, 15 minute rest and see how you are, because if you don't do that, then you're not doing your due diligence, and it's just going to end up with an injury happening.
Yeah, no, excellent. All right, I might just go to the floor and check out. There's some questions there. No, there's some good comments in terms of what other people are suggesting. All right, so I've got a question from a Jacinda Wilson. On the slide, what can be done to improve balance? It says to ensure workers can take personal mental health days. I'm not clear what that means. Can you maybe explain that one?
Some organisations add additional, maybe 1 day a month that can take off as a mental health day because you may be feeling run down and burnt. It can also be part of your personal leave. It just gives you added thing that it's there. If I'm feeling like today I just can't go because everything's happening, then it gives you opportunity to take that day off and recover.
Okay.
Recovery Partners actually has it. We call it doona days.
Yeah. Can you break down what a doona day is for me?
Basically, I stay under the doona and sleep and recover.
Yeah. Hey, it sounds so basic, but hey, at the end of the day, sometimes that's what you need to be able to, again, manage those elements of psychosocial risk, from whatever the scenario may be that can impact it. So absolutely. John, I had a question that was asked just as we were starting. If I've got a organisation that's high in turnover, and I guess from a psychosocial risk perspective, what do you think we could do to identify what the potential causes are? And again, some more generic recommendations about how can I get better with managing the psychosocial aspects of it? Again, having psychosocial as your sort of focus area for staff turnover.
Yeah, looking at that, it's going to be a collaboration between work health and safety and human resources in looking at is there some fundamental features? Is it work design? Is it also coming from harassment and bullying, or is there a lot of micromanaging? So it's basically looking at your exit interviews, what's being said in the staff turnover, and also is it in a particular area? If it's in a particular area and a particular team leader, that may show signs that there's an issue within that team. It may not be with the team leader. It could be with other team members within that are causing the issue.
Okay, so maybe having like a bit of an open door policy on, going to either HR sort of contact or something like that might be.
That's right. Yeah. So basically, there should be a process in place that you can raise these to your manager and to HR, P&C, because work-life balance, how that is effective is that if we don't have a good work-life balance, it leads to stress. So stress is a trigger for anxiety. Anxiety is then a trigger for mood swings, behavioural issues, and it's just a starting point. So if we don't have a good work-life balance, it's going to affect us both in the workplace and both in our home life. And at the moment, with the disconnect legislation, where does that all sit? Because a person should be able to disconnect at the end of the day. And in some organisations, that doesn't always occur.
Okay, excellent. All right, I might just put it out there again. Is there any last minute questions before we move on to the lucky door prize? Just going to give it another 5 seconds. 5, 4, 3, 2, 1. All right, no worries. Okay. Well, thank you very much again, John. Very insightful presentation. Lots to think about. Again, it's all about getting better than we were prior to this. So I'm sure you've been able to have that positive impact on all the attendees today. I've just rolled my little app device that has selected a participant in there. So it is a Megan Clark from the Ronald McDonald House. You have been the winner of today's Lucky Door Prize. The Lucky Door Prize is, in fact, a complimentary psychosocial review of your system. So I will send you through an email directly just to give you some information on how to retrieve that and go about it. So well done, and thank you very much. For those that have any other questions following this, please feel free to get in touch with Recovery Partners. We, again, have a number of services that we provide to support you and your organizations with managing psychosocial risks. We'd love to help out. So again, thank you, John. Thank you very much to everyone for attending. And we hope to see you in next week's next round, which is the manual handling focus area.
Oh, thanks sorry, again. Before we go, yes, you'll be getting sent out the slides. Someone just asked that question.
Awesome. Good on you. Thanks, John. Thanks, everyone. Have a great afternoon and weekend. Bye.
Bye.